Welcome on in, everyone. Okay, I see you guys joining on in. Okay, I see you, Priscilla. I see you, Chris. Ooh, I love when my people are on time. This is amazing.
How do I turn this on?
Miss Carly, I see you. Welcome on in.
Hello, can you hear me?
Yes, I can hear you. We're just waiting for a couple of more of my guests. Let me
Okay.
post it to my story. Give me a moment. Ooh, I'm getting okay, perfect. Oh, we good. Okay, I see you, Mr. Marvin. Let me bring you up. Everybody, okay, you guys, guess what? This is the fastest my team has joined on in early. I appreciate you guys. I love this. You guys are amazing. I appreciate you guys. Give me a moment. Let me just post it to my story. Let me let everybody know we are here. As we are coming on in, we are grabbing our daily heartbeat. We are liking the live. We are reposting. Ms. Mika, I see you. Thank you so much for being here. Mr. Marvin, I see you. Hold on. Let me just post it up to my story. You just bear with me. You know, we all new to this. This is still just added to my story. Let folks know we here, we live, and we're about to get into some good things. Okay, we good. Okay, so Miss, before we jump right into it, Miss Mika, she is still at work. Okay, so she can't come up on camera, but she says she gonna still yap and she gonna still drop the resources for us. So we still are grateful for her being here. Before we continue, also Miss Carly, thank you so much for taking the moment to be a part of this panel. I know it was last minute, but we're gonna keep Miss Crystal in our prayers. She did have a family emergency. I don't want to share too much. I don't know what she shared online, but she did have a family emergency. We're gonna keep her lifted in prayer, because that's is rough what she going through. But Miss Carly, thank you so much for taking the time to step in and fill in on a spot that I know that you would share more than enough resources and information for today. So everybody, I didn't even get to play my theme song. Y'all just joined on in and we just going to jump right into it. But welcome to a healing in progress, mastering your mental health. This conversation is important. This conversation is needed. Okay, so I want to thank you guys for all the work that you guys are doing. You guys are in the fight, okay, and the fight never stops. So thank you so much for everything that you guys are doing. I want to jump right on into it before we get into the nitty gritty. Can I have each of you just provide a professional background, an educational background, brief history of who you guys are, and what you guys do, whatever names you guys don't feel like dropping. You guys know we all know how to follow context clues and abide by HIPAA. So, Ms. Cardi, we'll start with you, then we'll go on over to Ms. Kirsten, Ms. Mika, and then Mr. Marvin.
Okay. Hi, everyone. So my name is Carly. I'm a licensed mental health counselor and board certified BCBA behavior analyst. I specialize when it comes to mental health in play therapy and EMDR. So I do a lot of trauma work across the lifespan, including with the 0 to 3 population, so very young children.
I love that. And Ms. Kirsten?
Hi, everybody. Can you guys hear me okay? Okay, perfect. My name is Kirsten Hilliard. I am a licensed clinical social worker. I am currently working in a school setting, so I'm a school social worker, also work in crisis facility. Um, so that is adult population. And I also just launched my business, so that covers clinical supervision, uh, it's a whole bunch. That's what we're gonna go out. Um, and I also am a doctoral student at Morgan State University.
I love that. Okay, and Ms. Mika? Miss Mika's been here before, but Miss Mika, just run down brief resume, brief educational background, who you are and what you got going on, Miss Mika.
Well, good evening, everybody. Again, apologies for no camera. I am at work, so I can't be on camera. But I am Mika. I'm a licensed marriage and family therapist. I have two jobs. I work in the hospital setting and I also work part-time for a domestic violence shelter. I work mainly with women and children. I have my master's from Capella. I know a lot of people crap on that, but it was good for me. My bachelor's is from Florida State, and I also have an MBA from Syracuse.
I love that. Thank you so much, Miss Mika. Mr. Marvin, last but not least, brief educational background, professional background, what Mr. Marvin got going on outside of TikTok.
Outside of TikTok. Hello, everybody. I'm Marvin. I'm a licensed professional counselor in Texas and national certified counselor as well. I work with adults, 18 plus, a range of concerns, mental health concerns, not always disorders, sometimes just concerns. But educational background, bachelor's in psychology, University of Colorado, and master's in counseling from Southern Methodist University here in Dallas.
I love that. Thank you so much. So once again, you guys, before we jump right into it, today's conversation, we all know the topic of mental health is still taboo. Don't know why, but it is still very taboo. So as we are listening to these conversations and these different topics that we're going to discuss, it's no judgment on our end, on nobody's end here. We are just here coming together, collaborating and dropping gems and showing you all that, hey, you are not the only one going through what you are going through. And professionals who look like us and sound like us can go through things as well too. So that's what we are all here for. So this is a safe space. We're just having a great collaborative conversation on an important topic within the Black and Brown communities. Okay, I just wanted to make sure I always just preface that. Okay, we're gonna jump right into it. Miss Carly, I want to start off with you. We do have a variety of different topics. You know, Dr. Johnson does his homework, and I have just two people in the chat drop Dr. Johnson does his homework, so you know I got my meeting agenda. Miss Carly, I want to start off with you. What drew you into working within the mental health space? Because I know you are a board certified behavioral analyst, but you also are a licensed mental health counselor. What drew you into the mental health space overall?
So I was actually a licensed mental health counselor first, and
Okay.
I had a mentor of mine that specialized in play therapy, and I just was so curious about that. Like, she always had all the supplies, and she would talk to me about mental health. I just didn't understand how play therapy related to mental health. And so I learned about the profession through her, and she just encouraged me to apply to my graduate school program.
You can hear me? Yeah. Is
Yeah.
audio still good? Yes.
Yeah.
Okay, perfect. Thank you. Mr. Marvin, what drew you to the mental health space overall?
Great question. For me, it was a combination of lived experiences and also professional experience. I worked in non-clinical roles in healthcare systems for a while, and I saw the plight of others, and I saw the difficulties that people could have. And then later on, I faced my own health challenge, and I saw the need that I saw why someone may need to talk to someone. I realized from a patient perspective, it's like, wow, it could be really useful to talk to somebody right now. But as other things we'll get into later, but because of background and family, community, I didn't do that at the time, but I saw the need for others. And
Right.
so I decided to pursue the profession.
Right. Thank you so much for sharing that. Miss Mika, I kind of already know the answer, but can you just briefly share with us what drew you into working within the mental health space? And the reason why I want to ask you is because you were working in a different area prior and you pivoted into the mental health space. Can you just briefly touch on that?
Yes, so I was working somewhere else prior to becoming a mental health counselor. I've always been one of those people that people come to me and just tell me things randomly. I'm
Hmm.
talking from my family to strangers on the street. And so when I realized I had that kind of gift and I really wanted to dive more into it, I had a therapist take me under her wing and show me all the things. And I was so enamored with the field that I needed to be in it. Having an MBA made me pivot because having that MBA and working in project management is hard work. Not that mental health isn't, but my heart is in this, and my heart was not in project management.
Okay, I heard that. And guess what? We can't be afraid to pivot, okay? Miss Kirsten, I know you are a licensed clinical social worker, and that field, interdisciplinary collaboration is key. Okay. To be a successful licensed clinical social worker, interdisciplinary collaboration is key. Okay. So I said all that to say you are bound to work within mental health and those who are needing mental health resources. Okay. So I just want to make sure I preface that before I asked you the same question. What made
Mhm.
you, or what do you enjoy the most about working within the mental health space under the umbrella of social work?
Yeah, so like you said, we cover a lot in with my degree. But really, I think I have that taboo answer of like I
Okay.
wanted the person, that when I was younger, I needed it. And I feel like that kind of would draw me to this, and not being able to identify what it was at that time, but learning more and just finding out more about mental health and how, growing up, you don't talk about mental health.
Right.
It was like, they fine. No, they're not.
Right.
And it's like those are the things that I was seeing, and people, like she said, like is it Mika? I hope I'm saying it
Mika,
right.
yeah.
How
Mm-hmm.
she said people were drawn to talk to me, and I'm just like, okay, there's something here, but I need to figure it out. And it wasn't until junior year where I actually figured out of college. Let me be clear, where I actually figured out what that was, and since then it's just been that. Like, I want to bring more awareness and attention because it's not talked about.
It is not talked about, and we're gonna come back to some of the things that are not talked about. Okay, Mr. Marver, I want to come back over to you. How has your understanding of mental health changed throughout your career or your personal journey?
As I mentioned earlier, it was one of those things we didn't talk about early on in my life and my family, community. And so I really didn't have a clear picture of it or idea of that concept at all of mental health, because just didn't talk about it at school, nowhere, it didn't come up. In my high school, the counselor was in charge of the yearbook. And assistant principal. So that's all they did pretty much all year. Mental health wasn't a topic. And so my understanding was largely shaped in adulthood. Seeing, yes, you saw cases of people with autism when I was a child, and so those extreme situations that were more outward you'd see, but you would hear about depression, anxiety, those things, and how they affect individuals on a day-to-day basis. People who are working and not so much just homebound or unable to participate in activities of daily living, and so. My understanding in a professional sense was shape coworkers. You hear about their plight, and then later on working with clients and understanding from their perspective, in a more in depth of how people try to navigate situations and the difficulties they face. It's not that people don't want change or can't do things or these things. Sometimes just not knowing how or not being in the right space for growth. And so I've learned that it is a process. It's not reading one self-help book usually that leads to that. It's a collective of different things that help someone get to that ideal place, a better place where they can function optimally.
Right. Right. Thank you for sharing that. Before we continue, you guys, I forgot to mention a thumbs up or a praying hands is me acknowledging you guys in the chat. I appreciate the gifts, you guys. I got work to do. Okay, I have questions to ask, so I'm not ignoring you guys in the chat. But a thumbs up or a praying hands is me acknowledging you guys in the chat. And thank you so much for everybody coming in and blessing my panel. We appreciate you guys. I appreciate you guys. We're gonna jump right back into the conversation. Okay, Miss Carly, we just discussed what ideally mental health would look like. So from your perspective, what does mental wellness realistically look like in an everyday life?
Mm. I really think it would require targeting prevention. So like our baseline is really like a healthy mental wellness all around, right? For
Right.
kids, for parents. Because I work with kids a lot, I see how that dyad is impacted, the parent-child dyad, and how generational mental health is something that is more common than I think we realize. And so I think really focusing on prevention would allow us to all feel well, because we would understand that if our neighbor is not well, it could impact us as well.
Right. Right. Thank you so much for sharing this. So, as you guys know, we have our meeting agenda. We just wrapped up lived experiences. We're also going to be touching on some topics on social services and accessibility, navigating stigma, stress management and burnout, medication and clinical treatment. Once again, medication and clinical treatment. Okay. Then we're going to touch on ADHD and neurodivergence. And then we're going to wrap it up on some reflections. Okay. So we're going to have Ms. Kirsten, the licensed clinical social worker, lead us on the social services and accessibility section. Okay, so Ms. Kirsten, what social services or community resources are underutilized but highly valuable? You know, I was tapping on you for this question.
Yeah, so some of the ones that I am seeing, again, I'm in the school setting, so we kind of very much, I work with all the populations, the parents, the child, all of it.
Right.
So just the school-based mental health, like we need to be in the schools. Um, and no, I love counselors, yes, but there needs to be a full team in the school to actually provide these resources and different and touch on different things in school. Parent education. Our parents, our parents have trauma. Our parents
Mm,
have,
mm,
they have their own stuff. And like that is a service, a resource that is needed really bad. Like we
right.
need to educate our parents on what this looks like in our kids. How it used to be is not what it is no more. How
Right.
they discipline is not what it is anymore. Things like that. Support groups. I think as a staff, EAP programs.
Mm-hmm.
Some of our
Mm-hmm.
teachers need to be utilizing it. Like they're stressed. So I think it's just a bunch of different things that really start there, that we're not touching on, that
Right.
we're not using how we need to use. And not enough resources. It's just not enough resources. Not enough people seeing the need for it and putting the money towards it to do it.
Right.
So
Right. Right. Okay. Well said. Well said. Thank you for sharing that. For those of you who are just joining on in, welcome to a Healing in Progress, Mastering Your Mental Health. I've tapped on some great individuals who are all working within various areas of the mental health space. So far, we've wrapped up some questions on lived experiences, and now we're touching on the segment of social services and accessibility. Okay. Ms. Carla, I want to come over to you because I think I want to hear your perspective as it relates to this question. But what role should employers, schools, and local governments play in mental health support? From your experience, the behavioral analysis perspective and the licensed mental health counselor perspective, what role should employers, schools, and local governments play in mental health support?
Okay. So I can go on about this. This is like a hot topic for me. And I think
Okay.
it links to the prevention that I spoke to earlier.
Mm-hmm.
I think there's a lot of initiatives that aren't quite hitting the target in terms of
Mm,
what the need is. So there's a lot of action, there's a lot of motion, right, when it comes to these initiatives to support mental health. But like if one program isn't talking to the other, then it's
right.
really not that effective. And so I think that's where, people start to fall through the cracks with these services. Like the intention is great. The intention is certainly there, but whether it's like grant funding or just like the lack of communication across different programs and across professions, I think that there could be a disservice that's done, not in all instances, but there certainly could be a disservice. And I think that more unity around that would help alleviate those people falling through the cracks.
Right. Makes sense, Ms. Carter. Thank you for sharing that. Mr. Marvin, I want to come over to you from your experience with working within mental health. Okay. I want you to tap into that perspective. What barriers do you think prevent people from accessing mental health or social services resources overall?
Right. I think, well, first, there's been a lot of improvement. I'll say that, but
Mm-hmm.
there's still a long way to go.
Mm-hmm.
When I say improvement, I think things like at one time transportation, which is still a barrier for many people, but telehealth has made mental health more accessible, being able to do a session from home or from work or wherever you are, if you can find that space. Not everyone has that still. Some
Right.
people are without homes or private spaces, and so that's still challenging. One of the biggest barriers is affordability. Insurance is a big part, at least the work I do. A lot of people have insurance, but then a lot of folks have high deductible plans, and that makes it hard to cover the cost of a session. Many people work and they have EAP sessions, but EAP sometimes limit people to 2, 3 sessions, which generally is not enough.
Mm-hmm.
It kind of it starts the process, and then it's like, oh, you're out of sessions, and so affordability is a big aspect. And there are a lot of nonprofits that do provide services for people to assist them with paying for therapy, or they cover the cost for them, but not everyone qualifies for those services. And so if I were picking one area, I'd say affordability.
Affordability. Okay. Okay. Go ahead, Miss Kirsten. I know. I know. Go ahead. Take it away.
So, just real quick, I feel like
Mm-hmm.
another one, yes, cost is really, yeah, there. But it's that culture mistrust.
Mm.
Um, and I feel like the African American community does not see, we don't, not we, the trust in doctors, the trust in the system, the trust in providers all around has really made a barrier because they're not going because they already have that mindset that you're going to overdiagnose, you're going to just want to medicate me or push me out the way, you're not going to want to hear what I have to say, you're just going to say I'll be fine, I'm going to get over it, and then it's just we already are in a system that is already against us
Right. Right.
Mm-hmm.
from the very beginning. So it's like, what am I going to ask for help for? Because you're really not, you don't really care. You're just going to do
Right.
it to check a box. So
Mm.
I
Say it
feel like
Mm-hmm.
again.
that
Mm-hmm.
is something that has just come up more and more, even in across all the systems that I'm a part of.
Right. Right. Thank you for sharing that, Ms. Mika. I hear you. You lightly hooting and hollering. Do you have anything you want to
Just
add to this
a
to
little
this
bit of hooting
topic?
and hollering.
I know. I
I
know
don't
you
have
do.
much, but we need providers that we're safe with. People
Mm.
who look like us, people who sound like us. The
Mm-hmm.
way I sound talking to y'all right now is how I sound in a session with my clients who look like me, who sound like me, who live the same life I live in this
Right.
same raggedy city that I live in, because I
Hello.
understand how it feels to have your mental health be deteriorating and
Mm.
you go see somebody and they immediately want to baker at you,
Hey.
5150 you. For what? Go be locked down for 72 hours. I just need you to hear me. And
Right.
that's what we need to do. We need to hear people. Yes, people do need to be hospitalized sometimes.
Mm-hmm.
Absolutely. We have to have safety plans. But
Right.
we need more people that look like us in these fields: social work, mental health, social services, period. There's not
Mm.
enough of us. And they
Mm-hmm.
want to continue to put boxes and barriers to keep us out of these systems because they
Mm.
don't want us to help our people.
Mm-hmm.
That's my hooting and hollering.
I know, I know. Thank you, thank you, Ms. Mika. Can I have two people drop my subject matter expert in the sticker for my whole panel today? Can I have two people drop subject matter expert stickers in the chat for my all of my panel today? We're about to navigate into navigating stigma. This is big. We're about to tap into navigating stigma as it relates to mental health. Okay, Miss Carly, I want to start out with you. Okay, um, why does stigma around mental health persist despite increased public awareness? We have a lot of people are having these kind of conversations. A lot of people are having conferences and various events and various collaborations. Why does it persist regardless of the public awareness? Why do you think? No right or wrong answer. I want your perspective, ma'am.
Yeah, so I think it links to what we were just speaking to with the cultural component of mental
Okay.
health for Black and Brown for the BIPOC community. And I think the people who developed the DSM that we use, right,
Right.
but we're part of a system and we don't get to make that choice. The people who developed it didn't necessarily look like us. They didn't necessarily understand the culture. And so I think that there's a little bit of a misalignment with how we're in a Western culture looking at what we're calling symptoms that creates this opportunity to misunderstand the person that you're sitting in from, which I think is one part of how that can be perpetuated.
Right. Right. Thank you for sharing that. Mr. Marv, I want to come over to you. How do you think cultural, generational, or family expectations impact people's willingness to seek help? Okay.
Well,
Let's
cult,
let's look past the we're gonna pray it all the way. Okay. I know we Christians in here. We're Christians in here. Okay. And
Not to pray it away.
no, the Lord, he works in
Because that's the
mysterious
first thing that
ways.
came to my mind, y'all.
Okay,
oh,
same. Because I was like, Lord, I got an answer for this. Ooh.
yeah, yeah. Many times that is top of mind for a lot of people
Hmm.
because that's what they've heard. You got God and you pray and everything else. And one of the things I try to tell people, I'm not competing. I'm on the same team. I'm a Christian too, and
Right.
so it's not like me against God or whatever. And so I think messages and families play a big part. Yes, Black community, we don't talk about mental health a lot. Asian cultures don't talk about mental health. They don't go talk to other people about their problems.
Right.
Latino communities,
Right.
many of the same situations. It's not as commonly talked about because that's something that was considered, for white people. They go into those spaces and talk to people, and so one of the biggest things that helps us getting outside of that space, the clinical space, barbershops, and having those conversations in those areas. I know my barbershop that I go to in Dallas, I go tomorrow, y'all leave me alone.
No judgment.
Thank you. Every now and then they host a mental health fair, and they have
Okay.
clinicians come and talk to people in the shop. And so I see the difference in that space versus a clinical space. People are more open to talking because that feels familiar. They grew up, early childhood going to a barbershop, and then you walk into a therapy space for the first time as an adult. It feels weird and strange, and you feel like you're gonna be judged, and yes, you may have someone who does not look like you, and that makes it even more challenging. So stigma plays a big part, and it ties into what we were talking about, affordability and other things there earlier. But cultural, that message still has to get out. There's still a lot of work to be done in that area, because just because we live in a city and we feel like, okay, word is getting out, not in all aspects of the city, and then in rural areas as well, messages are certainly not reaching those areas as much. So still a lot of work to be done. And culture, the more we can talk about it, it's become more normalized in TV and film, and I love to see that happening and discussing those spaces, but still so much more to be done within our communities.
Right. Right. Thank you for sharing that. Somebody in the chat done trying to take us somewhere else. Ren Patrice talking about, and the YT folks still the majority who pew. Whoa.
I saw that. I said, ooh.
Whoa. We're gonna continue. Miss Mika, you and I, we've had this conversation as it relates to like microaggressions. Okay. So I want you to tap in that, okay? But what are some subtle forms of stigma people may not recognize? Damn, you just disrespected me in my face and I didn't realize it was disrespect. And you came after my mental health, or you trying to stigmatize me. Take us through there, ma'am.
When people say they support your mental health journey, but they completely disrespect it in the same breath. You're setting a boundary, but they keep crossing the boundary. You say, hey, thank you so much for inviting me to dinner, but it's been a really long day. I just want to go home and rest. Oh, well, you ain't no fun no more. People talking crap about you. People pick on you for taking medication. Well, if you would just pray about it, you wouldn't need the medications. Subtle things like that. People support your mental health until it becomes inconvenient for them. And you're no longer of service to them.
Right.
That's all I got.
Okay, thank you. Anybody else got anything to add? Miss Carly, I know you do, Miss Carly. Miss Carly.
I think one that I hear a lot, especially in our community, is like, you're strong, or like, you can handle this. Especially, it starts so young. So like, young Black boys, I think, are really susceptible to hearing that. And I think that can kind of deliver the message of like, okay, whatever I'm feeling, I just need to kind of push it down and get over it, which I think is part of also how that perpetuates the stigma around mental health, because it's really pushing away from, let's talk about your emotions, let's talk about how you're feeling, let's talk about what's going on if you're experiencing depression, and just saying like, no, you'll find a way, you're going to figure it out because you're strong, or because you're the man of the house, right? Like, so there's so many conversations about being the one or stepping up to the plate that I think culturally we use a lot. And in some spaces, I think that can also lead to, perpetuating the stigma.
Right, Miss Kirsten. Thank you for sharing that, Miss Carly. Miss Kirsten, I see you. You can go ahead.
Because you got me. Because being a social worker, people in my family or people around me are like, if I'm having a bad day, well, you're a social worker.
Whoa.
Girl.
So
whoa.
You hit something in my spirit when you said that, because it's like, just because I'm a social worker doesn't mean I don't have bad days. Doesn't mean that I don't have my own things that I'm dealing with on a day-to-day. I'm still human. Like, I think that is just, it goes out the window.
Right.
Like, I
Right.
don't know.
I want to stay on you. Okay. I want to stay on you. Okay. So
Okay.
the social worker. Okay.
Hmm.
Constant interdisciplinary collaboration. Okay. How can workplaces, schools, and communities create safer conversations around mental health?
Um, I would say normalize it.
Okay.
That's my that's my spiel this month.
Mm-hmm.
Normalize it. Have the conversations about it. Provide education about what it is.
Right.
Talk about it. Like I feel like don't make it such a bad thing. And I feel like that will make people feel a little better and able to say, I'm not okay.
Right.
So I feel like that and that's really hard because I don't think other disciplines understand that. They don't come from the same level of empathy. They don't have the same level of social, emotional. They don't have all of those skills because
Right.
they dealing with their own stuff. But I think that it needs to be across all jobs that they need to be able to really have some sort of training
Mm-hmm.
that, and I don't mean, one day training for 2 hours, we just click the box, keep it going, answer a couple questions. But this needs to be something that's ongoing where
Right.
they are understanding that people have things that go on that will happen. You're one phone call away from a crisis. And you have to understand that. And I don't think I think people still have the mindset of this won't happen to me or
Mm-hmm.
that can never be me. And I just feel like we need to be able to everybody to understand that this you can be in their shoes. You could be that person
Right.
with one little thing that may happen that you
Right.
so just more training, education, like communication.
Right. Right. I love it. Thank you for sharing that. There is a question in the chat. I want to direct it towards you, Miss Carly and Mr. Marvin, from Frame Greetings. She said, as a mental health professional, how do you guys react to those bad days? Miss Carly, we'll start with you and then Mr. Marvin. How do you react to those bad days? How do you respond? How do you stop yourself from knocking somebody up across their head as a mental health professional? Because I know you got them days.
Yeah. So I think, putting as a professional, putting in a lot of work to understand yourself and understanding what your limits are.
Hmm.
That's like the first step. And I know that I had to put in a lot of work to self-reflect and think about like, okay, so why was this triggering for me and what does that mean for me?
Hmm.
And then that helps kind of mitigate situations like that to begin with. And so maybe they don't intensify as much in the moment. And then after the fact, really having boundaries in place. So like, I'm really
Right.
fortunate to have a friend group that really understands and respects boundaries or like is open to understanding them if I have the capacity to sharing what that might look like. And so making sure that I can put myself in position to um, have people understand if they don't already, that sometimes there is going to be a boundary. That doesn't mean like I don't like you or it's anything personal. It's just more about like today was a hard day for me and you might call me and I just don't have the capacity right now. And if I say that to you, there's no bad feelings.
Right. Right. Thank you for sharing that, Mr. Marvin. How do you stop yourself from whooping somebody across their head or crashing out as a mental health professional? In layman's terms, you guys know I'm always going to bring it. Always going to break it down for you guys. Okay. So, Mr. Marvin, how do you not? How do you keep your foot off folks' neck? What do you do? What do you do, or what do you not do?
What do great question. First, I agree with the things that were just said. I mean, it's really important
Hmm.
to have boundaries and space and friends and outlets to do things. Because one of the things some days are very challenging, but one of the things I do like about what I do is every hour is a little bit different. And
Okay.
so 1 hour may be the situation, next hour is totally different, unrelated, and it allows me to shift my mental space for a little bit. It's not that I don't think about that later. It's just that I don't have to be in that period for so long, depending on the day. Sometimes it's the end of the day, and that, let's say the last last client or whatever is in a situation, and that can linger longer. So having outlets, conversations, talking to others about things. Dr. Johnson, you've been in my life.
Mm-hmm.
I don't talk about mental health a lot. I'm not anti
Mm-hmm.
mental health.
Right.
I just need a space where, because I get a lot of mental health during the day. I get a lot of talking about
Right.
therapy, and so I need an outlet that's gonna be a little bit unrelated to what I do throughout the
Right.
day, because
Makes
I don't want
sense.
to be my whole day, because
Right.
that's not my whole life. It's a big part of my life, but I'm so much more than just a clinician in a mental health space. So I tell the chat at night, I like listening to something funny before I go to bed every night. Just getting a laugh in, finding those spaces, that room, making room. Same thing I advise other people to do, clients or whatever, is encourage them to do. I try to do myself. Hey, get out this week. I'll be traveling. Just take a trip, but you can't do that every day. Every time you have a
Right.
bad day, you can't just jump on a plane. But okay, what's my outlet today? What am I gonna? Can I get outside? Can I do something that benefits me, just to free my mind?
Right. I love it. Thank you for sharing that. Before we continue, once again, for those of you who just joined on in, welcome to Healing in Progress, Mastering Your Mental Health. I've tapped on some great subject matter experts, and we've navigated through lived experiences. We've navigated through social services and accessibility. And right now we're about to wrap up on navigating stigma. But I see you, Miss Riddell, in the chat. I see you, Kina, in the chat. Ms. Nene, I see you in the chat. El Meek, I see you. Pals, I see you in the chat. Something you can use. I see you guys in the chat. This is names I quickly saw. Mr. Aaron, I see you in the chat. I appreciate all you guys for being here. We're going to continue. But Ms. Mika, I want you to wrap up navigating stigma for us, okay? What advice would you give someone who fears being judged asking for help? Let them folks know if you need the help, you better ask for the help.
Period. And that's what I was gonna say too.
Okay.
Needing help and support, it doesn't make you weak. That makes you a human. That's one of the realest acts of self-awareness and self-respect that you can give yourself, is asking for help when you need it. Culturally, we're so often taught to just push it down, and we're taught how to survive before we're taught how to emotionally process. So really diving in and saying, wow, I really need some help, and you go and you ask for it, that's what you got to do. Ask for
Mm-hmm.
help. As my mama then would say, a closed mouth don't get fed.
It don't. It don't. It don't. It don't. Before I wrap up navigating stigma, I didn't add this on the meeting agenda, but Mr. Marvin, I want to make sure this is directed towards you, okay? Mr. Marvin, what do you have to say to Black men who are struggling with their mental health, but kind of ashamed or feeling weak? And also, what do you say to those Black men who are considering mental health? Because they're all the people who and holler that they need more men representation within mental health as it relates to Black and brown men. Okay, Mr. Marvin, what do you say, number one, to those young Black men or Black men in general about struggling with their mental health and apprehensive about seeking help? I want you to start there first, from your perspective, Black man.
Right. One of the important things I do say, most clinicians, you reach out to someone, they're going to have a consultation call. Even before you even get to that point, though, it's important to know you're not broken. You just have something that's not working for you right now. And it's
Right.
okay to have that in life, because we all do. And it doesn't mean you're weak, as someone just said. It's not a weakness. It's just something's not working. And so it's just a collaboration. How can we help you get to what you're wanting, where you want to be? What does that look like for you? I mean, and so, yes, having someone who looks like them does help a lot. I know sometimes I have moms who call for their sons, even though they're adults. They're wanting to get some help, and I'm like, well, I need to talk to that person, because I want to make sure they're willing to talk. But if we can
Mm-hmm.
just talk to them, and usually it's a phone conversation, just to engage, and it's not so super clinical where a person feels uncomfortable. It's like just getting to know somebody. It's just starting a relationship.
Right.
And because it's basically just a conversation between you and I, me and that client. And so getting past that barrier, it's hard depending on the message that person's received, because they have the preconceived idea, you're just going to listen, you're not going to say anything based on things that they've heard or seen. And it's like, no, I will engage.
Mm-hmm.
I'm not a person-centered therapist just actively listening. I do talk back, because that's what helps in conversations.
Right.
You can't be in a one-sided conversation. It's no
Right.
fun, not a relationship, not a therapist's office, anywhere. And so, um, again, not broken. Things just aren't working the way you want them to work. And so let's just talk about it and see what helps. Would you be willing to try one session, 30 minutes, 45 minutes to an hour, and we'll be done. But usually at the end of the first session, I usually check in with people because people come in there always nervous. Totally get it. At the end of the first session, how are you feeling right now? And it's usually a lot different when they came in. I feel so much better. This is not as I thought it was going to be. Once they get to that point and once they're engaged, but it's just getting in the door.
Right. I love that.
Right.
Thank you so much for sharing. You wrapped it up. You was done. I didn't want to cut you off.
No, just get in the door or that initial phone call.
Right.
That's it.
Right. Thank you so much for sharing that. I appreciate you. And guess what? I've had so many messages about people asking me, can you also find Black men? And once I connected with Mr. Marvin and found out that he worked within the mental health space, I've been connected with him ever since. Representation is important. And every time you come over into office hours with Dr. Johnson or there's a panel, I want to make sure that there's something for everyone. Everybody, you will never know what resonates with somebody, or you will never know where somebody's like, hey, he's doing it, she's doing it, I could do it too. Okay. So I just want to make sure I always continuously provide something for everyone. Okay, let's continue. We wrapped up we getting through this. We wrapped up lived experiences. We wrapped up social services and accessibility. We just wrapped up navigating stigma. Miss Carly, I'm gonna come back over to you. You good, Miss Carly? Checking in with you. You good? Let me practice what I preach. Let me check in with you. You good?
Yes. Thank you for
Okay.
asking.
No problem. What are the early warning signs that stress is becoming unhealthy? Woi, woi,
Oh,
woi.
okay. This is a loaded one.
Yeah, take us there.
I'm going to try to target it from in children, like teens
Okay.
and adolescents, and then also in adults.
Okay.
So when I'm working with young children or teens, adolescents, I should say, it's usually the behaviors that they're engaging in, right? So like maybe they were on like the cheer team or doing a sport and they're no longer wanting to go to practice. Maybe like they're just not cleaning their room anymore, or if they did ever clean their room, or caring about what their appearance looks like. Their relationships might be changing, and in some cases, they might be starting to engage in like risky behaviors in some of their friend groups. And so, those are some of the early warning signs. I usually, even before that, see like a subtle shutdown where maybe this person was really more expressive with their emotions and they suddenly stopped doing that. So to me, what that means is it's not even worth it for me to get angry anymore. It's not worth it for me to express my emotions. I'm like beyond that. So like your nervous system is in that state of collapse. And then for adults, I think it's pretty similar, except I would say that some of the behaviors that adults have access to engaging in can be more extreme, right? Adults just naturally have access to more things. And so, I mean, that could look like drugs. It could look like more intense promiscuous or sexual activity, that sort of thing. It could look like not going to work. It could look like, I'm on the brink of losing my home, whereas that wasn't a concern before. And there's just not the same desire to turn things around anymore. So those are actually like more extreme, but again, we have those early warning signs where it might be one of those things and it's just kind of brushed off. And then all of a sudden you look back and it's like multiple things compounded all at once.
Right. I love that perspective. Thank you so much for sharing that. Ms. Mika, I want to tap over onto you and hear from you. But how can people distinguish between temporary stress and more serious mental health concerns?
Well, stress is a part of our everyday lives. At
Mm-hmm.
any given point in time, we're going to have something stressful occurring.
Mm-hmm.
But when you notice things like you're persistently sad and you're anxious and you're hopeless, you're numb, that is when you should start seeing and showing some concern. Don't wait until you completely fall apart to go
Right.
get some help, get some assistance. Like I said, we're all going to be stressed at some point during the day. Shoot, I was just stressed out 30 minutes ago before I got in here.
Mm-hmm.
But
Mm-hmm.
I regulated myself like I tell my clients to do, and we got it together. I got a drink of water, and
Right.
now I'm on this panel with all you wonderful people. But yes, stress is normal. But when you notice that you can't get out of bed because you're so stressed out, like Carly said, you notice you're on the brink of losing your house because you're not going to work and you're not
Mm-hmm.
cleaning your room, you're not showering. things like just the small things. That's how you know it's gotten really serious and you really have to advocate for yourself.
Right, right. Thank you for sharing that. Kirsten, I want to come back over to you. And I think you kind of touched on this earlier on when they said that you the social worker and you know everything. Okay, that's another thing too. They be saying, "Oh, you the one that got all these degrees. You know every damn thing." No, we don't. No, we don't. Okay, let's tighten up. Miss Kirsten, how do you personally manage emotional fatigue or burnout while supporting others? You kind of touched on it, but take us a little bit more through there.
Yeah, I'm gonna set a boundary.
Okay.
For me, I'm gonna, no, I don't have the space or capacity for you. I'm gonna correct you in a respectful way, but I'm gonna make sure that no.
Mm-hmm.
So, but I practice self-care. I find other outlets. I get out. That's what I do.
Mm-hmm.
I I don't know. I say no. I believe in
Mm-hmm.
no. If I can't do it, I can't do it. Like Carly said, capacity. I know my capacity, and I'm not gonna overstep that. Because then I'm just hurting myself. I'm putting myself in a
Bingo.
spiral. So I'm
Right.
not gonna do that.
Right.
So I think that is where I'm at. And understanding that that is okay. I wasn't always here. I was very much like, okay, yes, I can do this. Okay,
Mm-hmm.
yes. Okay, yes. But now I'm in a
Mm-hmm.
space where no.
Mm-hmm.
And I'm okay with saying no. So
Right.
Mm-hmm.
Right.
that's kind of where I'm at with everything.
Right. Thank you. Thank you for sharing that. Mr. Mara, I want to come back over to you. How can high achieving professionals maintain balance without glorifying burnout? Okay, because we quick to say this part of the job, this part of the job, this part of the job. I'm tired, I'm drained, but this part of the job, we can't be glorifying the burnout. I'll repeat the question for you one more time. How can high achieving professionals maintain balance without glorifying the burnouts, the people them job?
Right, a part of the job. But I'll use this B word that's come up a few times. Boundaries. It's still part of your well-being. It's separating that too, because I usually ask a question. Why do you live to work, or do you work to live? Do you live to make life better, or is your purpose on this earth to go to work every day and do what you do for 16 hours a day or whatever?
Right.
And usually people think about it, and I work to live, to have a better quality of life. And okay, what are you doing to help yourself get to that?
Mm-hmm.
Are you treating yourself? Are you loving yourself in a way that's supporting that idea of a better quality of life?
Right.
And so you can be productive, you can be professional, you can do all that, but you can still have structure. Work is going to be there tomorrow, and it's going to be there the next day. They create that job for a reason, because it's going to be
Mm-hmm.
ongoing.
Mm-hmm.
And so the objective is not to complete everything in one day. Yes,
Right.
you have deadlines and things. Sometimes things get overwhelming, and it's a lot. So knowing when to pull back, just giving yourself what you need. Doesn't make you a hero just because you're doing all the work and doing work for 5 people. Doesn't, I mean, wow, hats off to you, but doesn't make you a hero.
Right.
It's just, okay, what do you really need? What's going to really help you? What's in line with your overall goal for yourself? And so
Right.
just taking that step back to focus on that. Keep the main thing the main thing. And if
Right.
that's living, live.
Right. Right. What I heard from you mainly was the job will be there tomorrow. In other words, the job will be there tomorrow while I'm out tearing off my back just to complete all the action items in one day. The job will be there tomorrow. Okay, I hear you, boss. I hear you. We're gonna wrap it up on. Do I see a hand? Do I see 2 hands or do I see 1 hand? Okay, hold on, Miss Kirsten. I saw 1 hand and Miss Carr. You see this one
The
before
hands
they
are up.
yeah, the hands are up and I'm ready to yeah. Before we continue, before they tap in, can I have 2 subject matter expert stickers in the chat? 2 subject matter expert stickers in the chat before my ladies give their perspective and drop their gems. Can I see some subject matter expert stickers in the chat, please? Can we let TikTok know that the chat is live and we here and we live and direct? Okay, I see them stickers. Miss Kirsten, I see you. Go ahead.
I was just gonna say, yes, rest. The work is gonna be there tomorrow, and you still
Mhm.
one. If you work for an agency, they can drop you in a dime. Okay,
Mm.
that's
Mm-hmm.
one. And
Mm-hmm.
2, your client's still gonna cuss you out,
Hey,
regardless if
whoa.
you regardless if you bust your back. You can go to war. They still gonna cuss you out. You still gonna be that B. You still gonna be so in different cases. I'm not saying for everybody, but you know to pause and not to overwork yourself, because at the end of the day, it is gonna come. The end of the day gonna come. Tomorrow's gonna be there, and you can try it again. But you still, the only person who's gonna respect you and show up for you the way you need to is you.
Right.
So
Hello, somebody.
prioritize you.
Right. Right. Dr. Brooke, I see you. Welcome on in. Miss Carly, I didn't forget you. I know you tapping on in. Tap in.
Rest is resistance, right? That's what they say.
Mm-hmm.
We have to take care of ourselves. I was thinking of an example of a boundary that I think is really important, especially in workplaces if we're working as an employee.
Mm-hmm.
And in some cases, I'm not saying everyone go out and use this. I'm not saying go rogue, but like in some cases, just because I can doesn't mean that I have to, right? And so I know I've personally been in situations where I was an employee and it's like, oh, like you work efficiently, like you get more done than your counterpart. I'm going to give you more work, right? But my boundary might then tap in and I
Right.
met my capacity for the day, or I'm done. I decided I'm done. So just because I can doesn't mean that I have to. And learning that that can be the boundary, I think is really powerful for this particular topic.
Right. Right. Thank you so much for sharing that. I need a couple more subject matter expert stickers in the chat before I continue to my next topic. That's why all of my guests are here. Can we have a shout out to Miss Carly? Can we have a shout out to Mr. Marvin? Can we have a shout out to Ms. Mika? Can we have a shout out to Miss Kirsten? Okay, subject matter expert stickers one more time in my chat, please. And Miss Keena, I see you in the chat. You trying to pull me out of character, Miss
Keena is
Keena.
in there.
Keena, you trying to pull me out of character, but I'm gonna keep it professional. I know how to do that best. I see you something you can use. I see you paper. We're gonna
We know how
continue,
to code
okay?
switch around here.
We know how to code switch. Yes. Oh, Kristen, you got something else?
Real quick, because Miss Carly made me think. You know,
Okay,
when
that's what we're here for. We're here to think.
When they say you accidentally become important at work.
Whoa.
Yup.
Whoa.
That be it, because you asked.
Whoa.
You done did too much. You just showed them that you're capable. Now they want to make it.
Did way too much.
Boom, boom, boom. No, ma'am.
But you know what doesn't match? The pay, because you're not paying me to do the work of two people.
Because
my checks still look the same every month.
Okay. But you want me to do his, hers, and her job.
Why is my caseload 25 and their caseload is 5? What's happening here?
Woo! They on a roll tonight.
Woy, we good? We good?
Wake it up, shake the table like K. Michelle said. We shaking the table.
Okay.
Woy. Dr. Brooke, don't start because y'all about to fight. You guys, this conversation is amazing. This is exactly why I did this. Okay, we're gonna continue. So for those of you just joining on in, so far we've wrapped up lived experiences, we've wrapped up social services and accessibility, we've wrapped up navigating stigma, we just wrapped up stress and management and burnout. That just took us through there. Now we're going to get into an important section: medication and clinical treatment. Okay, medication and clinical treatment. Nobody on this panel is prescribing medication to nobody. Nobody on this. We're just dropping gems. We're just sharing professional and acquired skills and knowledge. Okay, just a preface. You see, y'all know I know how to. Okay, I see you guys all nodding their head like, yeah, okay, we see you, Dr. J. Do that little disclaimer. I want to start off with you, Miss Carly. Okay, how should someone think about the decision to start medication for mental health? Boy.
So the way that I describe it to clients that I work with is sometimes we need like a catalyst to take the edge off. Like this doesn't define who you are as a person. It's not something that has to be long-term. Sometimes it really does complement the talk therapy or whatever type of therapy modality you're receiving. It complements that process really nicely, especially if there's going to be anything that could be potentially triggering that we might have to go through. So just something to take the edge off to help you be successful. And then once we get to a certain point in therapy, we can coordinate with the psychiatrist or whoever's prescribing your medication and maybe talk about what it might look like for you to wean off that med if that's your goal.
Right. I love that. Thank you so much. Dr. T, I see you. She ready. I see you, Mr. Marvin. Can you tap in on that? Anything you want to add to that? I'll repeat the question. How should someone think about the decision to start medication for mental health?
Right. I think one of the important things is, well, first I want to know, what have you tried first? Because I'm not anti-medication, but I do want to make sure it's something that's needed. And sometimes, yes, talk therapy can help a lot, but then there are times where you need more than that. And so, and one of the biggest worries is that, oh, I'll be on this forever. And the thing I tell people is, it's helping the medication. Medication is going to do a little bit. It's going to help you, but you also have to help it. And that's using the tools and things that you gain in therapy, things that you learn about yourself or how to cope with certain situations that helps medication be most effective. And then you work in conjunction with your provider, you work towards weaning off that when that time is right. But it doesn't necessarily mean it's lifelong for every situation. Yes, some people may need it for prolonged periods, but many times people have been able to wean off medication. So, and that's usually the biggest worry I hear. It's like, I don't want to, have this and this is affecting me. And then sometimes though it's career, it's related to the career. And there's a bigger concern. Pilots, for example, taking certain medications could cause them to lose their pilot's license. So they worry about that.
Right.
And so it comes back to self though. What's most important? Yes, your career is important, and I realize that provides for your standard of living and your quality of life. But also, your life is important. Your personhood is important, and that's a big decision. It's like, okay, do you get what you're really needing, or do you continue to pretend, that you're gonna handle this in a different way, and it's not working. And so that's challenging for people. So it's definitely a conversation that has to be. That's a needed conversation. With everyone.
Right. Thank you so much for sharing that and being so transparent. Ms. Mika, I want to come over to you. What signs suggest it may be time to seek professional evaluation beyond the self-help strategies, beyond the, oh, let me just go drink a cup of tea, beyond let me just go pray it away? I'll repeat the question one more time. What signs suggest it may be time to seek professional evaluation beyond self-help strategies?
This kind of ties into what I was talking about earlier. So when you notice that you're in ongoing distresses and they're affecting your daily life, and that's when it's worth seeking the help. If you're always exhausted, like I said, if you're always overwhelmed, if you're always anxious, you find yourself being disconnected from people all the time, that is when it is time to seek professional evaluation and stop sitting on the ground, twiddling your thumbs and pretending it's going to go away, because it's not. We're at the point now where you're about to hit crisis mode.
Right.
So let's go ahead, be proactive and say, hey, I need to reach out to this EAP hotline. Hey, I might need to call the lady and go find a couch to sit on. Or if you're too far gone, hey, maybe I need to check myself in for 72 hours and really get some deep help. We have to stop just sitting with it and trying to pray it away, think it away, drink tea it away.
Okay.
Like my grandma would do, put some holy water on it, holy oil it away. Baby, it doesn't work. I love the Lord and he know my cry, but
Love the Lord.
please go
Ooh,
get the help.
shut up.
Please.
Love the Lord too.
The Lord helps me do what I do for you. So please help me help you.
Right. Because
I'm a
faith.
Christian as well.
Okay.
The Lord knows that you need that help, just like you know you need that help, like your mama them know you need that help. They just don't
Wait.
want to be honest with you.
Whoa. Do y'all see? Whoa, you just threw me off. But can I have subject matter expert stickers in the chat, please, before we continue?
Say it
Miss
again,
Carly.
Dr. Candace. Pray, drink the tea, and
Yeah,
call the
Dr.
lady.
I wish I
Amen.
could pin that. Pray, drink the tea, and call the lady. Dr. Candace Brooke. I'm not even gonna get into you, okay, Dr. Candace Brooke, because you're gonna take us through there. Miss Carly, let me hear from you. What are common myths or fears surrounding psychiatric medications? Okay, from your licensed mental health professional perspective. I'll repeat the question for those who didn't hear in the chat, because I want us to really talk to everybody in the chat. What are common myths or fears around surrounding psychiatric medications? Mr. Marvin already said the fear of never being able to get off of it. That's a lie. Okay, I've been on. I'm gonna be transparent. I've been on them. I'm not on them now, but I've been there. I'm sure everybody else in this panel has, not to put nobody business out there, but I'm sure other people on this panel have been through situations where they, needed help and they got off the help, and look at them now. Now they're on a panel.
Absolutely.
Miss Carly, come on, man.
So I think in my line of work, the biggest thing that I see is that medication causes things like autism.
Okay. Whoa.
And so that's like, I know, like probably a topic for another day.
Or
But
Tylenol. Excuse me. Sorry to cut you off. Or
yes,
Tylenol.
yeah,
Tylenol?
yeah. So that's the one I hear the most.
Anything else you want to add on the panel? Common myths or misconceptions surrounding psychiatric medications. Anybody else want to add anything? Miss Kirsten, Miss Mika,
I
Mr.
think
Marvin?
people fear judgment about being on medication.
Yeah.
That's
Yeah.
exactly what it is. I hear that so often from clients like, oh, well, what if I have to go on XYZ med? And
Okay.
what about it? If you do,
Right.
it's going to provide you stability. And what you take every day is nobody's business but yours, your psychiatrist, and the provider that's giving you the pills at the pharmacy.
Right.
That's nobody else's business. We have to stop being afraid of being judged. I know that's easier said than done. I don't sit on a golden throne. I have to tell myself that sometimes, girl, just do what you're going to do. If I got to go take that med, I'm going to take that med. If you
Right.
could take a birth control pill every day, you could take an
Whoa.
SSRI every day.
Okay.
Yes.
Okay.
Don't, ooh, Chad. You
Can I
Whoa.
add one thing too?
Miss Carly, yes, you definitely can.
I think a misconception is that you can wean yourself off your medication. Please do not do that. Please work with a professional that prescribes the medication, and do not just decide to stop taking your medication cold turkey, or that you're going to cut pills in half. Like, please work with a professional that knows the medication that you're taking
Right.
before you make any changes to your medication.
Right. Right. We do have somebody in the chat that said all medication is not good for you. That's why. What would you guys say to that? That all medication is not good for you, Miss Carly, Mr. Marvin, Miss Mika. What would you say?
I'll let somebody else go.
Okay, Mr. Marvin,
That's
what would you
true.
say?
yeah.
That is true, and having a relationship with your provider or prescriber is really important. If you're having nightmares or you realize, okay, this is not something that's best for me, usually there's an alternative. Finding something that works for you, whether it's a different dosage or whatever, or if you're worried about liver problems and something else. Okay, hey, I'm concerned about this. Is there something else that we could maybe try that could help me get the same results or similar? And so just having an ongoing conversation with your prescriber.
Right.
Yeah. Same, I agree. And it could just be a dosage change. It could
Right.
it's so many different things that it could be. So really just being able to communicate when you're not feeling okay, and like right away, and not letting it drag out 2 weeks and I'm having SI thoughts. That we want to be able to communicate those things right away when you are not feeling okay. But it also comes to making sure that you have that relationship with the provider and able to have that conversation.
Right. Right. And I do see a couple of things in the chat. Priscilla said, we'll be too dependent on it. Yep. I do hear people say that. Her Divine Alchemy said your mental doc can talk to your medical doc and make sure you're not taking the wrong stuff. Exactly. That's why I always say healthcare is collaborative. Have your healthcare team collaborate and communicate, because you are their priority as their reason for the work that they do. Okay. I think oftentimes people forget that. You are these professionals' priority. Okay.
I
Let's
think one
continue.
thing,
Sure.
that may have been said, but just the side effects of things. I know I've heard people just talk about, weight gain or
Yep.
physical change,
Yep.
personality change. And sometimes I've actually had, working in a crisis facility, have people just say how, but what is life going to be like then? Like fear of that new experience. They don't know what that looks like. So yeah, I'm going to be stable, but is stable still gonna get all my needs met? Or
Right.
is me being in crisis because I know I can come here going to get my needs met? So it's like little things like that as far as crisis wise that I run into with the devil.
Right. Right. Thank you so much for sharing that. Ms. Carter, I'm going to come back over to you for you to wrap up the topic of medication and clinical treatment. How can medication complement therapy, lifestyle changes, or community support? And anybody else can tap in after Ms. Carly.
Yeah.
Yeah.
Well, I know I mentioned earlier taking the edge off. And
Mm-hmm.
I do EMDR therapy, which is I usually describe it as an expedited counseling process. So you're going to go through some of the depths of yourself, your versions of self, parts of yourself that you may be trying to forget. So you'll be prepared to do this work. I am going to support you in the navigation process as you're going through this journey. And medication can really just complement that to take some of the edge off. And then post EMDR, once we've worked through all of your treatment plan, we can evaluate if you need it or not. And I've worked with several clients, adult clients for EMDR that were taking medication. I worked with their nurse practitioner. And after successful treatment, they were actually during treatment, they were feeling the intensity of their symptoms decreasing. So I would collaborate with the nurse practitioner, decrease medication, continue to monitor them while providing EMDR treatment. And eventually they weaned off of the medication and never needed to go back to it. So it just complements.
Right. Thank you for sharing that. Mr. Marvin, Ms. Mika, Kirsten, anything else you guys want to add to that? I'll ask the question one more time. How can medication complement therapy, lifestyle changes, or community support?
One of the things as I mentioned earlier, it's working together. Yes, your provider, your prescriber, also your medication. You think about things like depression and the mood states that cause, and you think about behavior such as drinking alcohol. Are you helping that medication by what you're consuming? You're taking something that's a depressant, and you're taking an antidepressant. So you're sending mixed signals. So just keeping certain lifestyle factors in mind. Because yes, medication can be effective, but
Right.
you have to help it to be most effective.
Right.
Yeah, and sometimes people don't want to give up the behaviors,
Mm.
and they want the medication to do a certain thing, and they don't get the result, and they're disappointed. But hey, there's some other things that you can do, but you have to be willing to do.
Right. Right. Thank you so much for sharing that. I do want to address a question in the chat. The Moving Buddha said, are there any leading people of color that are doing research on medications that you guys may know of? Or do you know where people in the chat can go to find out more research from Black researchers as it relates to medications? What would you guys recommend if somebody wants to, do some research on medications for them? Where would you recommend? And they're a person of color. What would you recommend they do, or where would you recommend they start their research first? Anybody can chime in on the chat.
I know that take it how you want, but I feel like starting off, one is even me being in school, research on us is not there. It's not as you gotta search. But one thing I am finding, if I know AI is a thing right now, but I have went to chat and asked, and then from there, like they have brought up some articles,
peer-reviewed articles, right?
Yeah, some peer-reviewed articles, and then I will follow. When you go to references, then you follow the next one, and then you follow the next one, because it is very limited. But if you find some key, like nice strong ones, that would be like the best way to kind of, do your own research, just peer-reviewed articles and building off of it.
Right.
But it's limited.
It is limited, especially with the funding and the current administration. That's a whole other conversation, but it is definitely limited as it relates to just Black research. If I'm gonna keep it a buck, Black research. Okay, let's continue, y'all. We've wrapped up lived experiences. Y'all, we going through this lived experiences, social services and accessibility, navigating stigma, stress management and burnout, medication and clinical treatment. We're about to get into another great topic. ADHD and neurodivergence. I know the neurodivergence, that's like another term that's been trending a lot for the recent past couple of years, and I couldn't leave it off this list. I had to make sure we touch on this, okay? So, Miss Carly, we'll come back up. I just like starting up at the top and then coming back down, okay, Miss Carly? So we're gonna start off with you. How has public understanding of ADHD and neurodivergence evolved in recent years from your perspective?
Oh, okay. Well, I think the biggest change that most people may have picked up on is last month was Autism Acceptance Month. And prior
Okay.
to using the word acceptance, it was awareness. So
Mm-hmm.
just language around awareness not being enough. Like we just can't be aware of people that are diagnosed with autism and neurodivergence. We need to accept them, which would include things like having modifications in classrooms or whatever public setting to help us not only understand how their brain might work differently from our own, but to help them feel included in the
Right.
process instead of excluded.
Right. Thank you for sharing that. Mr. Marvin, anything you want to add to that? How has public understanding of ADHD and neurodivergence evolved in recent years?
All right, and as you mentioned, neurodivergence has become a trending topic. I know earlier in the chat, someone mentioned narcissists and black men, for example,
Mm-hmm.
and a lot of things have become trendy per se. A lot of terms are thrown out there,
Mm-hmm.
not always accurately used. And so ADHD is one of those things. I see adults, and so I talk to a lot of adults who are not diagnosed in childhood, and so they're trying to understand why they have difficulty with certain things, such as focusing and or maybe being hyperactive or too impulsive at times, and so narrowing that down for them can be a challenge. But once you get to that point, it's helping them recognize those patterns that are contributing to their distress. And so publicly, you hear more about it, which is good, but it's a mixed bag because, oh, well, this causes autism, this medicine or whatever causes this and all this, or this person isn't that. It's because it's not ADHD, it's just because you didn't get your ass whooped and all these things or whatever.
Mm-hmm.
And so messaging is important. And right now, I think there's a lot of work to be done in that area, culturally, nationally,
Mm-hmm.
in so many different domains, but much more to do. But yes, it's talked about more, but that's not always in the best interest of improvement.
Right, right. Thank you so much for sharing that perspective. Ms. Mika, I want to come back over to you. How can someone advocate for accommodations without feeling ashamed or being labeled difficult? I'll repeat the question one more time. How can someone advocate for accommodations without feeling ashamed or difficult at work?
Accommodations are support to help you be
Mm,
able to do well in school or to do well at your job. I'm gonna be real honest and vulnerable. I have dyscalculia, which is a learning disability around math.
mm-hmm,
So I had to have supports from grade school all the way through college to get through
mm-hmm,
things. I was ashamed because why are my friends' brains working but mine doesn't work the same way? I
mm,
had to learn that if I don't go advocate for myself and get these accommodations that I need, nobody else is going to stand up and swing the bat for me.
right.
So we have to remember that the loudest voice in the room to advocate for you needs to be yours. Unless you physically cannot speak, then we can have somebody step in for you. You just have to reframe it. You're not
Right.
getting special treatment, you're getting support that you need. People feel guilty about needing those supports, but there's a
Mm-hmm,
reason that those supports are in place. People have to stop placing blame on themselves for needing assistance in any way, shape, or form. People deserve an environment that they can function successfully instead of having to stumble through everything and then hoping that everything turns out okay.
right. Right. Well said. Well said. Ms. Kirsten, licensed clinical social worker, I want to hear from you at this topic. How can someone advocate for accommodations without feeling ashamed or difficult? Part of one of the duties as your job is, providing various programs and resources for your clients. What would you say to those?
Um, I would say honestly, I feel like a lot of it is education. Educate
Mm,
people about it. Having a better understanding of what it is. What does it look like? What does the accommodation look like? I actually ran into this today at work,
mm-hmm,
and we were talking about, a child receiving services. And mom was like, no, I don't, they don't need anything because I don't want, we were talking about 504 IP based off
mm-hmm,
of behavior. And I don't want them labeled. I don't want them in a system. I don't want all of these things. Your son just flipped the desk, like not even a desk, a full table. We
right.
have to put things in place, but we're so limited. And I think mom maybe doesn't understand what it really is. What does these accommodations look like? What does support look like? What is actually ADHD? What is neurodivergent? What is, I don't think they are educated enough, or the conversations are there enough to explain what we are actually trying to do, what this actually is. And I feel like that is very difficult all around. Did that answer it? I know I
Yes,
kind of
it
jumped
did.
in,
It did.
but
I wanted to hear from you, and I'm gonna piggyback off of you too. I've had students who's reached out to me and did not want to look into accommodations because, listen to this. Let's all lean in. They didn't want that on their diploma, or they didn't want that they received accommodations on their transcripts. I almost wanted to flip the table on them, and I said, "That's your private information." Then like HIPAA. Okay, we're in school, but let's
yeah.
HIPAA. And those were health management students, so they understood what HIPAA meant. Why would your accommodations for you to receive this education be on your transcripts or be on your degree?
They don't,
So
but
when you
and that's, they're not educated about it. No
when you said
one's talking
educate,
about it.
exactly, no one's talking about it. But once again, it will not be on your it will not be on your transcripts. It will not be on your diploma. What's going to be on your diploma? Your name and the degree that was conferred. Hello, can I get an amen?
Okay.
The
Okay.
degree that
Amen.
was conferred. Let's continue. Miss Carly, I want to come back over to you, okay? What are common signs of ADHD or neurodivergence that are often overlooked, especially in adults or women? You see what I did there?
Oh, okay. Can I talk about children too? Because that's, I think, overlooked.
Woman and okay, adults, children, and also I want you to tap into
Yeah.
women.
So I'll start with women because I think women are more often missed when it comes to a diagnosis of ADHD. Typically, people think of ADHD and hyperactivity, um, typical like boy play. If we think about like young children, so like moving around a lot, hyperactivity, that sort of thing, high activity levels. Women are typically more sedentary in terms of their work, right? So it's the intention that we're actually looking for, the executive functioning, how they can organize themselves in the workplace. And oftentimes women, I think, just kind of figure out how to make it work for them so they don't receive the diagnosis, but they're actually having a hard time with some of those more subtle skills. Specifically, Black boys, I think, are sometimes misdiagnosed with ADHD, but the symptoms that we see are usually high activity levels, sometimes aggression. So that like explosive outbursts, difficulty in school, trying to like elope from certain topics. So like if they're having a hard time with math, they might try to run away when math starts or have an explosive behavior when math starts. And I want to just point out that that's could be potentially a misdiagnosis because sometimes it's not ADHD when we see that. It could be something like PTSD. So same exact symptoms and not actually ADHD. So
Right.
I covered women, children. There was one more category you wanted me to get to, but
Adults
adults.
in
Okay.
general, right.
I think typically when I see adults in general, especially males, because I talked about women, males in general present similarly to the description that I gave for boys, but they're just going to be having maybe a more difficult time maintaining employment, more difficult time maybe within their relationship. Maybe if they're a parent, they're having a difficult time with their own child, right? Maybe they have to work on some of those parenting skills, or they're easily triggered by their own children and it causes an explosive behavior. So impacting their areas, their functioning.
I love that. Thank you so much for sharing that perspective, Mr. I know, Kirsten. I'm coming to you. I know. I see you. Take it away.
So that what you made me think of is, and it's actually one of my last research topic, is we do have a lot in our culture, in African American culture, we are highly misdiagnosed. We are
Yeah.
one less likely to be diagnosed and diagnosed correctly. And one of the things is that all children are not the same. That's one across the board. Things that our culture happens in our home may look different than what happens in other homes culturally. And all of those things play a role. Sometimes it's not they're being disrespectful, disruptive, or they're talking back because she has too much sass. No, that is culturally maybe how we are, what happens in their home, or it's different things that I think are not being taken in account, and it is showing up in those diagnoses. It's showing up in just easily overdiagnosing, and that's with the ADHD. That's with the anxiety, depression. And after a while, you get told that you're too sassy, you too this, you too that. I mean, I'm gonna be upset too. I'm gonna shut down. You know, you see all these different things. I just feel like we are not culturally aware or culturally. It's a lot with the diagnosing and misdiagnosed, especially in African American families
Right.
and children.
Yes,
Right.
cultural competence with providers is
Oh,
like missing sometimes, and I think that's
I was
exactly what
just
you're
about to
talking
say
about.
that.
I was just about to say that too.
That because like we would understand the lived experience part of it before jumping to a diagnosis, but if your provider doesn't have that same cultural competence, they might be more likely to misdiagnose you because they're interpreting. You guys, I don't know if you guys saw on social media the girl in the hospital that was hitting her braids. I'll never forget
I
that example.
didn't, but
She
it
was hitting her braids.
I can see culturally how that would have had somebody alarms going off.
Mm.
That allegedly the nurse referred her to the psych ward for hitting her braids, and it was
Maybe
just
her
like
head
Yes.
itched. Her head
Yes.
itched. This you gotta
She just
Yes.
needed to get them braids out of that scalp wash and see now you got my
Right.
girl locked up.
She done
that's
got
like
her.
we would have understood that, but if your provider doesn't have that cultural awareness, or they're taking offense to it, or they feel threatened by it, all of a sudden it's escalated, and it just perpetuates what we talked about with the mistrust within the system.
Thank you for sharing that.
Absolutely.
Thank you for sharing that. I appreciate you guys for being so transparent and just, just taking us through there. Mr. Marvin, I want to come back over to you. From your perspective, how does anxiety, depression, and ADHD sometimes overlap or mask one another? What would you say?
Another great question. You really did a great job with the questions tonight.
Thank you. Thank you.
As always. But I think presentation of each one of those things, you think about anxiety, how it may lead to someone to behave, may become more hyperactive because they're worried and on edge. You take that with ADHD and the hyperactivity in that, and it may look a little similar. And the same token with depression. Okay, I'm depressed, but then let's say I have a mood swing. I have a little period of up. Does that mean that it's because of this or this? Now we do know that anxiety and depression do run together a lot. They hang out. And sometimes you see one. Often, a lot of times you see one, you see the other. Not always.
Right.
And so it takes that therapeutic relationship is so important. And sometimes it's going back a little bit. Because what came first, chicken or the egg? Okay, how do we get to this point? What thoughts? How are your thoughts impacting you? Your feelings. Okay, are you worried about something? Are you fearful, or is this something that you've seen since maybe childhood? I'd like to think you weren't worried about bills at this age at 4, and so maybe this is a pattern that's related to something else, maybe more in line with ADHD versus anxiety, and so. Having that relationship with a therapist is so important for that reason. Because sometimes yourself, you try to figure it all out, and it's hard to figure it out because things get
Right.
what is it? Co-occurring. Co-occurring disorders are a thing. Was this person drink because they gamble, or they gamble because they drink? Sometimes it could be just both. It may not be one causing the other, or this one could be causing the other or be contributing to the other. And so we just talk about misdiagnosing and those things, and that could easily happen when you think about anxiety, you think about ADHD, and think about depression.
Right.
Just because I'm not hyperactive, does that mean I'm depressed? Or can I just be depressed, or maybe having just a sad day or a down period? And maybe that doesn't mean I'm clinically depressed. So there's a lot of overlap. So just careful consideration when talking about all three of those.
Right. I love that. I love how you broke that down. Anybody else want to add, or he nailed it, or we can continue? He nailed it. Perfect. Okay, we're gonna continue. So far, yeah, we're about to wrap it up. Once again, we've gone through lived experiences. We've gone through social services and accessibility. We've gone through navigating stigma. We've gone through stress management and burnout. We've gone through medication and clinical treatment. We just wrapped up ADHD and neurodivergence. Now we're gonna get into the reflection, and we're gonna close out. Okay, Miss Carly, we're gonna start back up at the top. What is one small action people can take this week to improve their mental well-being?
My favorite is learning about your nervous system
Mm-hmm.
and your ability to regulate. It looks a little bit
Mm-hmm.
different for everyone. I think first understanding how your nervous system works is a big part of that process.
Right.
Then once you understand how it works, maybe considering what you have stored in there and starting to kind of chip away at some of the things that are repeatedly activating you.
Right. Right. Anybody else want to add to that, Mr. Marvin, Miss Mika? I'll repeat the question one more time. What is one small action people can take this week to improve their mental well-being, Mr. Marvin?
I say if you identify three outlets. Usually I ask people, what do you enjoy doing? Most people come up, what helps you? And most people come up with one thing. They were mentioned in the gym, but I'd say try to identify three. Summer is coming. Most of us in the Northern Hemisphere. So if
Mm-hmm.
summer is coming, try to find one that's outside that gets you outside of home, or because a lot of folks work from home. What
Right.
separates you from that space? Just something that you enjoy doing that can be an outlet at times when thoughts get heavy, or you're just like, oh, wow, I need to breathe. What can I do? Is it going playing sports with a group of friends, or is it
Mm-hmm.
just walking outside, or is it something I can do around the home that just brings some satisfaction? So just identify three things this week.
Right. Right. Miss Mika, I want to come over to you. Oh, Kirsten, you got something you want to add?
Yeah, I was just gonna say my one for this week is if you need to identify a boundary and set it, set
Set
it.
it. Okay. Are we gonna set it? Okay. Can I have two people drop in the chat? Set it. You heard Miss Kirsten. Miss Kirsten said to set it. Can I have two people drop in the comments to set it? Come on, y'all not moving fast enough. Are y'all finna
Oh,
set these boundaries? Come on, set it. I want to go on to Miss Mika next. Can I have
yes,
two
sir.
people in the chat? There's a kind of a lag, so maybe I'm gonna give y'all some grace. I know we did speak about grace and boundaries, so let me not pressure y'all into doing nothing y'all don't want to do. But can I have two people drop set it in the? There we go. Okay, I see you, paper. I see you, Priscilla. I see you. I see you, Miss Mika. I want to come over into you. Okay. What does genuine support look like when someone says they are struggling? I see you, Eve Rose.
This is a big one for me because I've had to train myself not to do it because it's what I do for
Mm,
work.
mm-hmm.
It's listening without trying to fix the problem.
Ooh,
People often, myself included in the past, I do not do this anymore unless it is with my child because as a mama, sometimes I have to step up and fix the problem.
right,
But we have to stop listening to respond, listening to fix the problem. Sometimes people just need you to be an ear. Sometimes, if they can just get it off their chest, they feel so much lighter. So, stop listening to have a fix. Everybody doesn't need you to fix them in that moment.
yeah, yeah. Miss Carter, I want to hear from you. I'll repeat the question one more time. What does genuine support look like when someone says they are struggling? I need help, ma'am. I'm struggling.
Yeah, yeah. I like Mika's response, listening without trying to fix it. I think just checking in, like, what does that person need, right? Maybe they just need the support. Like, and sometimes I say that because maybe the person can't verbalize it. They really don't know. Like, do you want feedback from me or do you just want me to sit here and be with you? One of the things that I say specifically to parents all the time is sharing space is so important. Um, Sometimes, especially if your child is expressing a lot of emotions, and I don't care if they're really young or a teen, sharing space can feel like such support
Right,
because sometimes there's not all the right words. You don't know what to do or what to say, and they might not know what they need, but you can still be there with them. And I think that that is just so valuable.
right, right. Thank you so much for saying that. Well, y'all, we did it. We did it. We wrapped it up. But before I let you guys go, Miss Mika kind of knows what I'm going to ask next. So I'll thank you so much, Miss Mika. I will leave her for last. Okay, but I'll start off with Miss Kirsten. What is your overall why? Your why as to the work that you do, why you keep showing up. What is Miss Kirsten's overall why?
Um, I would say my why is because I see a need and I want to support it.
Hmm.
I see children really struggling. I
Hmm.
see families really struggling.
Hmm.
Um, Making those connections, relationships are struggling. And I feel like my why came more as a school social worker, now more than ever. Like, working with adults, yes, I've seen, different things, but right now, seeing that firsthand, working with the families and how communicate relationships lack, time lack, all of those things. And it's like, if I can make a small difference and be there for a student, a family, a mom who who has to work all day, two jobs, and still try to get their child to school when we close every other day, y'all. So, but like, I think that has been my why and really push me, my business development, my all of those things. So that's I think that's where I'm at.
I love that. Thank you so much for sharing that. Mr. Marvin, what is your overall why? The reason why you continue to show up?
Well, as I mentioned earlier, mental health is an area I had to catch up on in adulthood because it wasn't something I was talked about earlier. And I will be very transparent. I did not go into it with the culture in mind. I did not go into it with that in mind. But since I entered into the field, I learned so much more about that need. And I realized how much more of a minority I am as a Black male clinician. And unfortunately, I can't see everybody. I'm limited to Texas, and I can't see everybody in Texas. But I do enjoy the part I have in this whole space of creating a space where people can grow. I have a plant behind me that someone gave me a few weeks ago. It's like, thank you for creating a space for me to grow. And so that plant symbolizes growth. Now I have to do my part and keep it alive.
Right.
Fingers crossed. But my why is tied to that need, and it's something I really enjoy doing on a daily basis. Of course, yes, having outlets, but when I'm in that space, there's nothing I enjoy more than helping someone who's going through a difficult time, and then often seeing those positive outcomes. Don't always get to see it. Sometimes people, move on or don't say anything or whatever, or experience it, don't tell you. But when you hear about that, it's just you light up inside. To know you're making a difference, and that's really valuable. So that helps me get out of bed every day.
I love that. Thank you so much for sharing that. Miss Carly, what is your overall why as to the reason why you continue to show up?
I think my response would be pretty similar. I really do enjoy helping people. I think people have like limitless potential. I really believe in the good of all people. And just kind of being a facilitator of the process is something that I am really passionate about. No matter what your background is or your culture, like if you want it for yourself, I believe that you can achieve it.
Thank you. Thank you. Thank you. I appreciate you for sharing that. Miss Mika, what is your overall why and the reason why you continue to show up?
You know, this is my favorite question.
Mm-hmm.
My why is very simple
Mm-hmm.
because I want people to have a safe space to be a
Mm-hmm.
person and not feel ashamed.
Mm-hmm.
When I was younger, I needed somebody to be there for me, and somebody wasn't always there for me. And I want to
Mm-hmm.
be that space for people. I want to
Mm-hmm.
show up for people in the best way that I can. I want people to feel seen. I want people to learn something from me. I want people to reconnect with themselves. I want them to know they're not alone.
Right.
I want people to understand that you look at me and I look like you. If I can do it, you can do it too.
Right.
Now, do I completely cater to just people who look like me? No, I have a very diverse client roster. But my heart and my focus has always been Black men, women, and children because
Mm-hmm.
we're so often just undervalued
Mm-hmm.
and never seen, and people don't think they can do it because they don't see people that look like them.
Right.
Mental health is wealth. This is a safe space, and you're always going to be safe in my room, be it in
Mm-hmm.
person or virtual. And
Mm-hmm.
if I have just a quick second to circle back to the small action that people can take, you
Mm-hmm.
know what I'm going to say, Dr. Johnson. It's going to be a
Mm-hmm.
happy meal.
Mm-hmm.
And people who don't know me don't know what a happy meal is. A happy meal is 3 small things in a day that brought you joy. Be it getting your favorite candy out of the vending machine, the lights were all green on your way home, you had a
Mm-hmm.
really good shower that morning. Just 3 small things that brought you joy that day. And one more thing as to why I do this is because service is and has always been in my heart. And as a devastating diva of the Delta Sigma Theta Sorority Incorporated,
Okay.
service
Okay.
is always going to be big for me. So
Hmm.
serving my community and the surrounding communities has always been big on my heart.
I love that, Miss Mika. Thank you so much. Once again, before I drop you guys off individually, I just want you guys to briefly run down your live schedule. When can we tap back in going on? Um, can you guys hear me? Hold
You're
on,
back.
okay, you can hear me now. I was getting a call. I'm sorry about that. So you guys hear what I
Yes.
said? Before I drop you guys down, briefly give us your schedule. When can we learn more about you? When can we, connect with you again? What is your live schedule? Miss Kirsten, we'll start with you because I know you got a lot going on this month. Okay, we'll start with you. And I see you doing a lot of work on here, and I appreciate that work. If you know me,
Yes.
I love the effort. I say this to my students, and I also tell it to those friends and family and coworkers and colleagues on here like you guys. I love when I see you guys on here sharing your work and really sharing your subject matter expertise. So if you guys ever, want to share something to me or need me to engage, please send it to me. I love to support. I love to engage. We got to fight against it. I say this to all my people. We got to fight against the algorithm, and our people have to see the work and the resources and the gems that we are dropping. So, Miss Kirsten, I'll start with you. What's your live schedule? What you got going on for your platform?
Yes. So, I have not been doing live as much because I have been so busy with
Hmm.
dropping. I started my business this month. I have my first event at the end of this month.
Okay.
I am launching so much and really investing in myself right now.
Right.
But one thing you could do on my Instagram, I do monthly series. I was a little behind this one, but
Hmm.
this month is my monthly series. It is Normalize This Mental Health Edition for May. So just talking about different topics that come up, like normalize whatever, blah 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 blah. So I try to drop that at 8 o'clock. I'm a little late now because we
Hmm.
on here, but they are my people understand that they're gonna get it. But yeah, so that is my platform for TikTok. So
Hmm.
yeah, I just followed everybody, by the way. So I'm looking forward to connecting with you guys. You guys are amazing.
Well, Miss Kirsten, I appreciate you taking the time to step into the conference and share your acquired skills, share your acquired knowledge. We're definitely going to stay in contact with each other because we locked in.
Absolutely.
I'm
You
gonna
got
go
me
ahead and
here.
we locked in. I'm gonna go ahead and drop you down. Okay. Continue to
Okay.
show up. Continue to show up. Continue to be great. Okay, ma'am.
Well, you as
Thank you,
well. Thank you
Kirsten.
for
It was
the
a
space.
pleasure.
Thank you guys.
Mr. Marvin, when can we hear more about you? When can we tap in with you? What is your live schedule? The people want to connect with you. Where can they learn more?
All right. I am live pretty much every night of the week. That's going to be changing a little bit this week. Next couple
Hmm.
weeks, I'll be on vacation. So I'll just be doing some pop ups here and there, maybe not every day, but check back after Memorial Day. I'll be nightly at 9 p.m. Central Standard Time again. And most nights in a live, I try to mix it up. As I mentioned earlier, I love mental health. I love talking about it. And I do
Hmm.
answer questions about mental health when they come up. But generally, I try to think about some other things, other topics, whether it's
Right.
trivia
Right.
or just chatting about life and other aspects, food, whatever. Just mixing it up because it's an outlet for me as well. And I try to provide that space where people can come and enjoy, have some sense of enjoyment before going to bed. Um,
Right.
I rock people to sleep, basically. So, so come by, check it out, or send me a message. Just I'll try to respond as soon as possible.
I love that. Well, sir, thank you so much for all the work that you do. Continue to show up and continue to be great. Okay.
All right, thanks for having me back, Dr. Johnson. I
No
appreciate it.
Thank you,
problem. No
Marvin.
problem.
Thank you. Good talk.
Oh, I'm so Miss Carly. Um, when can we tap in with you? The reason why I got connected with you was because I saw all the great work that you've been posting, and I was connected with another BCBA, and then you know how the algorithm works.
Yes.
It started to push your content, and I said, hey. I need to be tapped in with her. So how can my people and anybody else who is interested in you, or if something resonated with them, how can they tap in with you?
So like you have my handle, you can follow me here, same on Instagram. I will actually be going live tomorrow talking about
Okay.
today. And a newer practice to the field of ABA, which is like assent-based practices, really common to mental health, not so much on the ABA side yet. So yes, that will be tomorrow at 1 p.m. Eastern with Britt, which I think you came on that live, Dr. Johnson.
Yep.
Weeks ago. What else? If you go to the link in my bio, you can sign up for a newsletter. We can stay connected that way. I put resources up there. There's freebies up there. I have a children's book that's up there as well that I came out with almost a year ago now at this point. That's available. You can read about that and how it relates to mental health.
I love that. Well, Miss Carly, once again, you guys shout out to Miss Carly. Okay, we all know Crystal had her family situation, and I reached out to Miss Carly. Okay, I'm gonna be transparent. Okay, I reached out to Miss Carly last night. Miss Carly checked her schedule. She said, "Yes, Dr. Johnson, 7 p.m. works for me. Can you what are we going to be talking about?" I said, "Ma'am, I have a whole meeting agenda." I emailed her the meeting agenda, and Miss Carly got prepared for today. Okay, I could have spiraled, I could have crashed out, but guess what? I understood. Life be lifing, and life happens, and I under. We what are we talking about? Changes and be
Yes.
okay and pivot. Okay, and I
Gotta pivot.
pivoted, and I pivoted and found another great mental health professional to come on and drop gems. So I just want to. I couldn't say that. I had to say that with you on it. So I just appreciate you for taking the time so last minute, and just coming on here and sharing your skills, sharing your knowledge, and just building your community overall. Okay, Miss Carly?
Thank you so much for having me.
No problem. So
Thank you, Carly.
continue to show up, continue to be great. Okay, ma'am?
Thank you. Thank you. Have a good night.
You too. Ms. Mika, I saved you for last because I know you don't really have that much of a life schedule. So I don't know if I had to pour into you a little bit before I dropped you down. But Ms. Mika, so you see, I continuously invite you back, and
I
I
see
would
that.
I would love for you to really find the time. I know it's hard, I know it's busy, and if you want to set your boundary with me, you can. I know you quick to knock if you buck, but
Big plotter.
I would love for you to find time to come on here and really lean in and drop some gems as it relates to the work that you are doing. I do see there's a lot of dating shows on here. There's a lot of relationship experts. They're all sharing their experience, but we don't have that therapeutic aspect of it. I would love for you to come
Correct.
on here and really just drop those gems, your subject matter expertise. Okay, ma'am?
Well, you know what, Dr. Johnson? It's real funny that you say that.
Okay.
Because
Okay.
I have been plotting and planning
Mm-hmm.
behind the scenes, and
Mm-hmm.
I'm working on getting my live schedule all together.
Okay.
And I'm going to start doing some lives at least
Okay.
once a week. Because you
Okay.
see, I already drop content. I call it
Right.
my digestible therapy tools
I
every
love
Monday,
them.
Wednesday, Friday, and on the weekends.
I love
But
them.
yes, the last time we talked about this, I really had to sit with myself and say, you know what? There's a lane for everybody.
Right.
And I see other LMFTs, and I see LMFTs that look like me,
Mm-hmm.
but there's only one Mika, and
There's
ain't nobody
say
gonna do it like me.
whoa, 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 whoa. Hello, hello.
So the live schedule is in the works. I'm starting to
Mm-hmm.
get my plan together. I'm gonna start doing panels. It's
Mm-hmm.
gonna be great. Hopefully, we're shooting for August is when I'm
Okay.
shooting to start. So after summer break, after I get my baby settled back in school, that
Mm-hmm.
is the goal.
I
So
love
hold
that.
my feet to the fire, hold me
I
to
will.
that.
I
Y'all hear
will.
me in here saying that, so please hold me to that.
I will.
Live is not my favorite thing, but you know what? Sometimes you got to come out that box.
You do.
You got to
You
come out that
definitely do.
comfort zone.
You definitely do.
And I have gifts and tools, and I want to make sure that I'm using those gifts and tools before the Lord says, you know what, girl, stop playing with me. I'm going to
Whoa.
take them.
Whoa. Okay.
So we're going to do what we do. So yes, y'all, please, if you don't already follow me on here, please follow me on here so you can check out my content. It's digestible therapy tools. And as a disclaimer, content does not equal therapy, and my inbox is not for therapeutic things. But I'm always here
Repeat
to
that.
talk.
Repeat that again, because I'm sure that also goes for all the other panelists that were up on here. Repeat that for them one more time, please.
Our content does not equal therapy, and our
Mm-hmm.
inboxes are not for therapeutic musings. We are here not for entertainment, we are here for education. We
Right.
want to share the knowledge with you,
Right.
but ethically, we cannot consult with you. One, off of social media, and two, especially if we're not licensed where you are. And I know all of us are not in the business of losing those licenses.
Okay. You gonna take
I
us somewhere
paid way
else.
too much and cried too many tears to lose my license. So,
Hello, hello, hello. Can I
hello,
have you?
somebody.
Hello, hello, hello. Yo, yo, yo. Hello,
Hello, somebody.
Miss
Somebody.
Mika. Miss Mika. You see Dr. Brooke in the chat. She said we want your lives, Miss Mika.
Yes, I saw her, and Keena said she on my
And Keena says she on it too. And Dr. Brooke, Dr. Brooke been busy too. Dr. Brooke is working on some things behind the scenes, and she was very busy, But I'm gonna tap back in with Dr. Brooke real soon. But
Listen,
I just want you guys just to lean in on the subject matter expertise that we, like you said, blood, sweat, and tears that we fought for,
absolutely.
and share it for free for those who look and sound like us on here. That's my
Yes,
goal.
because people too often want to hop on TikTok and make money. Money's not the end goal for everything. Now, does money help? It sure does, but
It sure
money's not
do.
everything. And while
It's
we're
not.
here, Dr. Johnson, let me pour into you for just a second.
Mm,
Let sit down right quick. Let me talk to you for a spell.
I was trying to hurry up and throw you off quickly.
I know you were. Eye to eye. I
Hmm.
see you. I just want you to know, black
Hmm.
man,
Hmm.
black doctor, I am so, so proud of the person you are, the
Hmm.
content you produce, the education you give to people, the way you give of yourself, time, education, everything. You are a gem. You are
Thank
not to
you.
be overlooked. If y'all are in this room, obviously you have either seen Dr. Johnson's content, you follow him, or if you came off of the FYP, you need to lock in with Dr. Johnson. That's not somebody you want to sleep on.
Thank
Also,
you.
while you're here, go and check
Hmm.
out Onyx Links because that jewelry's fire.
Ms. Mika, I appreciate you, Ms. Mika. You're the best. And thank you so much. Every time I reach out to you, you always tell me yes. Even on my panel as well too. Kirsten, Marvin, Crystal, and Carly. You guys tell me yes. So I appreciate you guys continuously coming back and supporting me. And Ms. Mika, I appreciate your kind words. As you know, we locked
Absolutely.
in. We locked in, okay? And
Locked in. Ain't no
there's
switching up.
ain't no switching up. There's so much more work that it seems like I might have to be your project manager for your content. Same thing with Dr. Brooke. Let me say her full government, Dr. Candace Brooke.
Dr.
It sounds
Candace
like,
Brooke.
yeah, it sounds like I may have to be your project manager for
Hey,
your
you know
content.
what?
Same thing, Dr. T. It sounds like I may have to be your project manager for your content too. So we locked in. I appreciate every single one of you guys being here. And also, before I let her down, you guys got me to over 150,000 likes. I appreciate you guys so much. Miss
Y'all
Mika,
did that.
Miss Mika, continue to show up, continue to be great, okay?
Thank you, sir. Thank you for always thinking of me. I appreciate
No
you.
problem. I appreciate you too. All right, y'all. We wrapping it up. I'm tired. You know what I'm about to say next. I'm tired and I'm what? Hungry. I gotta go eat. Dr. Brooks said, I promise I'm coming back. Dr. Brooke, yeah, let me just be transparent real quick. Dr. Brooke was supposed to be on this panel too, but she was busy. I understood her. And you guys, if I ever reach out to y'all and you guys tell me no or right now is not a good time, don't ever feel no ways. I know I'm here juggling 4 jobs. I know when somebody say they busy, they got a lot going on. I'd never take no offense to it. So if I ever reach out to you or scheduling doesn't work out, I get it. I'm not a fussy person. Things always think life be life. And Doctor, I see you. Welcome on in. We're just about to wrap it up. So, but Dr. Brooke, there's something I'm planning next for the month of July. They told me that that's another month for mental health awareness, specifically for Black and Brown folks. So I would love to invite you back for that conversation. Um, Hopefully, we're gonna talk on the back end. But everybody, couple deuces in the chat. I appreciate you guys all for being here. I appreciate you guys for continuously supporting me. I will be. Hold on, let me pull this down before I wrap up, tomorrow, as you guys know, I got interviewed last week by Her Divine Alchemy. But tomorrow I'm getting interviewed again. I finally, are releasing my control and allowing some of my friends on here to interview me. Okay, so tomorrow at 9 p.m., her El Meek will be interviewing me. We're gonna be discussing overthinking the job search and some other stuff. But the topic of the conversation is overthinking the job search because it can be stressful. Okay. So before I go, kind of drop a couple deuces in the chat. Inbox me the live so I don't forget. Ms. Mika, I'll inbox you. Aaron Turner, I see you. I'll send it to you too. Dr. T is another one who want to interview me too. Dr. T, we're gonna speak on the back end. We're gonna get that interview in. Her Divine Alchemy, El Meek, and Dr. T. Those are my three first interviews that I trusted those three ladies to, interviewed Dr. Johnson. I see y'all in the chat. We're gonna wrap it up. And they said my stomach growling. How you know my stomach growling? I appreciate you guys. So tomorrow, 9 p.m. Eastern Standard Time, Dr. Johnson will be interviewed, and then I'll be back on Thursday for check-ins with Dr. Johnson. That's gonna be more relaxed. I can take off this button up, and I'm gonna just be chilling with y'all on Thursday. Okay. Keena said for me to hang up and go eat. I appreciate you guys. You guys are the best. Taylor, we wrapping it up. Now time to go eat. I appreciate you guys.